where we left off in terms of prevention and treatment for drug abuse. I want to preface this by saying that this information was taken from the National Institute on Drug Abuse Preventing Drug Use Among Children and Adolescents research-based guide. You can actually find this on the internet. This particular one, this information was provided by the U.S. Department of Health and Human Services, and this is the second edition. There may be a more recent edition that's out, but most of this information comes from that. And you're going to see that a lot of these prevention tips and principles and research-based principles come from the research that's been done looking at prevention programs for children and adolescents, because that's sort of the target zone, trying to educate parents and educators, like teachers, children, community leaders, and trying to get everybody sort of on the same page. And you're going to find that that is kind of where the prevention programs try to really tackle, is making sure that everybody's on the same page and the same message is getting out, that the parents are sending, the teachers are sending, the community is sending to children and adolescents about drug use. So just a few of these principles. I've got them kind of just listed based on number, but I'm going to tell you guys about sort of looking at this in sort of a categorized fashion. So we're going to talk about the first 4 principles, which are basically factors that are sort of lumped into the risk factor, protective factor sort of category. So the first principle is all about having prevention programs that enhance protective factors and then reverse or reduce risk factors. You can't just look at the situation in groups of kids and say, well, let's just make sure that any protective factor, like, for example, parental support, is going to be enhanced, and we're just going to stop there. You have to look at this sort of holistically, because the risk of becoming a drug abuser involves the relationship between the number and types of factors like protective factors, parental support, and risk factors like deviant attitudes and behaviors, and looking at the relationship between those things. So you can have a child who's really high risk, who has, a deviant attitude, has deviant behaviors, but has a really solid support system with parental support, community support, and things like that. And they may be able to come out with a much better outcome than a child who has a lot of risk factors and very few protective factors. So you want to make sure that those prevention programs are enhancing the right protective factors and then reducing or hopefully reversing some of the risk factors. One thing that you have to consider too is that the impact of risk and the impact of protective factors are going to vary and change with age. So a risk factor within a family is going to have a greater impact on a younger child, while, for example, association with drug abusing peers might have a more significant risk for an adolescent, since during adolescence, the peer relationship is sometimes stronger than one that you see from parent to child, because, adolescents are starting to gain their independence and they're starting to put a lot of focus on the relationship between their friends versus the relationship between parents. So, understanding that the risks and the protection changes with age, and it's sort of hierarchical in a way that some are more important than others, depending on the age. Also have to consider that early intervention with risk factors, for example, aggressive behavior, poor self-control, often has a greater impact than later intervention, because it's going to change the child's life path or trajectory away from problems and toward positive behaviors. So the earlier that you can get in on those potential risk factors, the better, because you want to be able to help change the path of the child. Whereas if you try to tackle it later on, when the kid is older or during adolescence, you're going to find that is going to be a lot harder to change and to modify. And another thing that we do have to consider is that a person's age, gender, ethnicity, culture, environment all come into play with the risk and protective factors, and we have to consider and be respectful of, for example, ethnicity and culture when designing these particular prevention programs. For Principle 2, these prevention programs really need to address all forms of drug abuse, whether alone or in combination, but looking at things like underage use of legal drugs, for example, tobacco or alcohol, using illegal drugs like marijuana, depending on state, heroin, and the inappropriate use of legally obtainable substances like inhaling spray can, paint in the spray can form, for example, or prescription medicines or over-the-counter drugs. So looking at kind of tackling all of these things. You can't just say, oh, don't use marijuana or don't use heroin or don't use, this illegal substance. You do have to also look at substances that are easily obtained, that are used inappropriately, and address that. For Principle 3, prevention programs really need to address the type of drug abuse problem in the local community. So, for example, in Southwest Virginia, we know that we're in an opioid epidemic. This is very specific, where people are using pain medications. For example, they might get Vicodin or something from a person who's got a prescription and might be taking it from someone else. Looking at what is the problem in the area and being able to target the modifiable risk factors and then strengthen the protective factors. So you want to make sure that you know your area, you know your group, you know your audience, and that you are taking the appropriate steps to making sure that you're targeting the right problem in that particular local community. The fourth principle is about tailoring, again, to address specific risks to that population, to that audience. Not only what is going on in the local community, but what is, the age, gender, ethnicity, to make sure that program is going to be effective. So you need to make sure that you understand both the local community as well as the specific group of children or adolescents that you are targeting for this prevention program. And that will improve the effectiveness because it's tailored to that particular group. So principle number 5 falls under what we would consider prevention planning. And this is specific to prevention planning for a family program. So Principle 5 is that family-based prevention programs really should enhance things like family bonding and relationships and include things like helping parents with parenting skills, practicing and developing, discussing, and enforcing family policies on substance abuse, and also training in drug education and information. You want to make sure that the parents understand and are educated on how drugs are being used, how certain substances are being used as drugs. If you can improve the bonding and the relationship between parents and children, what you're going to find is that's going to really help with the communication and help with how supportive the parent is to the child, help with involvement in general. And so one particular aspect that's really important for drug abuse prevention is that the parent is monitoring, supervising the child. And so sometimes parents don't really know how to do this. They don't know what the right level of supervision and monitoring is. They don't know how to monitor properly. And so what these family-based programs do is they help develop these skills. And sometimes it's child specific, and some kids need a little bit more monitoring than others, and depending on age and all those things. But these family programs really help to build these skills by enhancing with training on rule setting, techniques for monitoring activities, how to praise children for appropriate behavior and reward them properly, and then how to set specific rules and how to moderate and be consistent with discipline that's going to enforce those family rules. Some parents struggle with consistency, and these programs help build the confidence and also skills to be able to do that. Being able to educate parents or caregivers on the harmful effects of drugs, and making sure that it matches with what the children are learning in other programs and so or other places. And what you're going to find here is, when we're going to talk about this kind of throughout, is that it needs to be consistent. So what the children are learning from parents, what the children are learning from teachers, what the children are learning from community members, all need to be consistent across the board. Because when you have inconsistency, then the child or the adolescent gets confused or doesn't know and starts to justify different behaviors. And you want to make sure that everyone is well educated. And so, teaching parents about the harmful effects of drugs, making sure they're educated, will also open an opportunity for things like family discussions about the abuse of legal and illegal substances, and the parents are educated enough to have a good conversation with their kids about it, and be able to be open and willing to discuss and talk. We find that a lot of times these even brief family focused interventions for the general population can lead to positive changes in specific parenting behaviors, and these can reduce later risks of drug abuse. And so, helping to enhance those protective factors of parental support, even in more brief interventions. Now, principles 6, 7, and 8 all fall under prevention planning still, but in this case, school-specific programs. So principle 6 is all about the earlier the better. You can design a prevention program to intervene as early as preschool, and they are going to address risk for drug abuse. So, for example, looking at preschool children and seeing how aggressive they are, how their social skills are, looking at academic difficulties, being able to predict who kind of needs a little bit more help and who might, perhaps be starting off on the wrong path. And so being able to identify and assess those kids and say, okay, let's tackle this group, will be really helpful to be able to set them on a better path. Principle 7 is more so about looking at elementary school children, and what they should target. So prevention programs for elementary school age children should really look at improving academic learning, improving social emotional learning, and addressing those risk factors for drug abuse, which again, very similar to the preschool, is aggression and academic failure, and of course school dropout. So when you're looking at education in these kinds of programs, you should really focus on skills like self-control, emotional awareness, improving communication, improving social problem solving, which of course goes into education and learning about emotion, about peers, and about being able to have friends in a healthy manner and in a healthy way. And then finally, academic support, because one of the most important milestones in elementary school is learning to read. And so, being able to have a literacy program and to identify any children who might be at risk in this particular area is really important. Principle 8 is kind of moving up the chain with the school programs, looking at middle or junior high and high school students, and what these particular prevention programs should really address. So we're looking at increasing academic and social competence still, but with the appropriate step for a more mature child. So here we're looking at study habits, improving academic support, improving communication, improving skills for peer relationships, self-efficacy and assertiveness, trying to build those drug-resistant skills and saying, okay, it's okay to say no. Kind of think of like the Just Say No program, but better than that, because that wasn't very effective. But being able to do things like run scenarios with kids and have them practice and inoculate themselves from the peer pressure of using drugs. Also doing things like building skills to reinforce anti-drug attitudes and strengthen personal commitments against drug abuse. So really getting them to internalize that and to be able to say, okay, this is not what I want to do. I'm going to stick with it. And, I'm not going to be forced to do it. So still looking at prevention planning, and this time for Principle 9, we're looking at community programs. So Principles 9, 10, 11 fit under the community programs principles. And so Principle 9 is looking at community programs that are going to aim at general populations. And it's really important to look at key transition points. So looking at kids who are transitioning to middle school, for example, from elementary school, transitioning to high school. These are all transition points that are really helpful to kind of aim at without singling out high-risk families or singling out at-risk populations. And so what that ends up doing is it produces a benefit across the board. So the benefits go to the low risk, the medium risk, and the high risk families without singling out those high risk populations. And so you're going to reduce labeling, reduce stigma, and you're going to promote bonding to the school and community. And those people who are in that high risk category won't feel like they're, kind of singled out and that they're a problem. And that's really helpful in these kinds of situations. Principle 10 is all about combining effective programs. And so looking at, for example, family-based programs and school-based programs, combining those is much more effective than a single program alone. But remember that what's important here is that you need to have consistency within the message. So if you have a family-based program and a school-based program, and that's wrapped into a community prevention program, there needs to be the education and the message consistent across all of those programs so that the parents are teaching their children the same thing that the teachers are teaching, the same thing as the community members are teaching. So that way there's inconsistency and there's no confusion. Now Principle 11, again, still falls under the community prevention program. This is looking at reaching populations in multiple settings. So not just the school, but looking at things like clubs, after-school clubs, faith-based organizations, media, looking across the board on all of the different kind of settings and making sure that the message is consistent and that in each setting, the community-wide message is consistent. And that's going to make the most effective prevention program. So when we're talking about prevention program delivery, 12 and 13, principles 12 and 13 really fall under these categories. And so principle 12 is all about when communities adapt programs to match their needs, community norms, or differing cultural requirements, they still need to retain those core elements of the original research-based intervention. So it's difficult sometimes when you have, I'm saying we need to cater these programs, but when you cater the programs, you still want to maintain the integrity of the prevention program that is derived from empirical-based research. And that can, of course, be difficult to do because you want to change the program enough to fit the needs, but you don't want to change the program enough so that it's no longer valid. So there's three major points that we need to, and elements that we need to consider here: structure, content, and delivery. So structure is all about how the program is organized and constructed, and make sure that the structure of the program is the same as that original research-based intervention. Content, which is the information, the skills, and strategy of the program, again, needs to be consistent with the original research-based intervention. Because even changing something as simple as some of the information, not teaching some of the skills, we don't know what part of the program might have made it the success it is. And so if you start leaving stuff out or modifying things, we don't know, it's no longer going to be validated, and we don't know what that outcome is going to be. And then finally is delivery. So how the program is adapted, how it's implemented, how it's evaluated. You need to still make sure that you deliver the information and deliver the program in the same manner as it was originally done. And so this, again, can be difficult to do, but you just need to make sure that you try to follow it as closely as you can, with also taking into account the needs of the community, the needs of the group that you're aiming for. Principle 13 is also along these lines, in that, in order to make sure that the program is successful, using things like booster programs, repeated interventions to reinforce the original prevention goals is really important, because research shows that the benefits from middle school prevention programs, for example, diminish without follow-up programs in high school. So if you have a program and you don't follow up and you don't reinforce those ideas later on, then you're going to end up potentially not being as successful as you could be. And so those are definitely important things that we need to consider. For Principle 14, and this is kind of like its own sort of point here, it is involved in delivery of the prevention program. But one thing that really helps, and some might not really realize how important this is that educators really need to be trained on good classroom management practices. So, when we're looking at developing and delivering these prevention programs in the classroom, teachers really need to make sure that they're rewarding appropriate student behavior, that they're fostering the students' positive behavior, that they're fostering achievement, academic motivation, and school bonding, because this is important to make sure to develop trust and relationship with students, and to make sure that the right kind of behaviors are going to be rewarded, and that can help with reducing risk in the future. So for Principle 15, what's really helpful in these prevention programs is having interactive techniques. So instead of just saying things like, here's a bunch of information, read it, learn it, and be done, when you have interactive techniques like peer discussion groups, when you have parental role playing and allowing children to role play on how to say no and ways to kind of reduce the chance of peer pressure and reduce the chance of them, taking part in or putting themselves in that situation or being in that situation. These kinds of things that allow for active involvement in learning about drug use and reinforcing those skills have found to be most effective, rather than just being told what to do or told how to do it. When you give kids and parents the opportunity, and teachers, the opportunity to practice these skills and to practice them with the kids and children and adolescents, we find that it tends to be much more effective, because they're able to develop those skills by doing rather than by seeing or rather than by reading. And so those are very helpful. And then the final principle is about cost effectiveness. So similar to earlier research, recent research actually shows that for each dollar invested in prevention, you get a savings of up to $10 in treatment for alcohol and other substance abuse. And so this becomes, and this statistic actually probably has improved since then, since this is kind of an older statistic. It's kind of a late 90s, early 2000s statistic. But what you find, though, is that it is more effective cost-wise to prevent drug use than to just deal with it when it happens. And so, you're trying to, put these kids on a different pathway, and you're trying to help them. And so the idea is let's not, put them in a position where they're going to be, arrested or having to do treatment programs or something in the future. Let's do everything that we can to prevent that from even happening. So that's kind of, the sort of summation of different principles that are important for prevention, and specifically in children and adolescents through some empirical-based work. The very last thing that I want to just talk about very briefly, and we're actually going to talk about this more in class, is this idea of prevention and usually treatment technology. There's not as much prevention technology out there as there is specific to treatment. And so what you guys are going to do for this class is you're going to test out some technology. The best thing to do, and the most successful I've found with students, is to pick an app. And you guys can use your iPads for this. I highly encourage you to use your iPads to be able to, use your iPads and to kind of incorporate that into this class. Find something that you can search through the App Store, you can search online, you can do whatever works best. Find some kind of technology that's designed for people who are going through recovery. And so there's a lot of apps out there. I encourage you to try ones that maybe not are as popular, just to kind of see, because sometimes you can find a really, really nice system, nice app, nice piece of technology that is not as high rated or not as well known, but is very good. I do want to caution you though, regardless of technology that you use, whether if you go on a website or join a community or if you download an app, that you do not engage with people, because I don't want this to be like a imposter thing where you're going in and you are learning about people's situation and lives. That's unethical and not fair to go in and to kind of go in as a fly on the wall. That's really not what I want you to do here. I want you to test out, basically, do you think this app would be helpful to you or to somebody going through this process? And this is effectiveness of the app itself. So you can even talk about, hey, it kept crashing on me and I would never use this, or I tried to do this one thing, I clicked on it, it wouldn't work, or I have to pay for it. I don't want you to pay for any features unless you absolutely want to and you really want to try it out, or you think you're going to use it for yourself, for a friend. That's another thing. But if you are just doing it for the assignment, I would suggest not paying for anything. But maybe that's a deterrent. Maybe saying, I don't want to pay $5 to have this feature. And so, let me know how it works. Also, what are the features of the technology? Are these features that you think would be helpful? Are these features you think that you would use, or that somebody else would use? And we're going to have a discussion on this on what people are doing on March 5th. And so the idea is that you're going to actually write a report on this, and you guys will have a template on Moodle to do it. And there's a series of like sections that you guys are going to sort of report on. But I want you to give it a shot for, a few days, a week or so, at least, in testing this out, because I think that this will generate really good discussion, especially if there are a couple of you who might have tried the same one, and you might find that one person might have liked it over the other, or maybe you both had similar feelings. So we'll discuss this more in class to make sure everybody's on board with this. If you have any questions, you can email me, and have a